So first I would like to ask for your permission to use this video for educational purpose and on internet.
You sure can.
Now tell me, we went through a surgery about when?
About 5 months ago.
5 months ago. Now, your surgery, what were your symptoms before the surgery?
Before the surgery, I had numbness and weakness in my left leg and back pain 7 to 9.
7 to 9. And that has been, how long did it go on, that pain?
Well, I had back pain for the last 25 years, but this particular set of back pain was probably 3 months,
3 months
prior
that's
to the surgery.
Okay. And we noticed you had quite significant disc disease and even disc herniation and stenosis where the nerves were being pushed, and your back pain was significant enough that we decided to do a OLLIF procedure. We got a testimonial, and this is a follow-up testimonial. I remember just one day after the surgery, you were standing, you were walking. How did it go? How did the surgery go?
The surgery was amazing, and the first couple days after surgery is like a little honeymoon because of the local anesthesia in there. And I was worried about falling off a cliff when that local wore off, but it never really happened.
So you stayed in the hospital how long?
I believe I was in the hospital less than 24 hours.
Less than 24 hours. And then you went home next day. In the first week after the surgery, how bad was the pain? And same in the first month, and how bad is it now?
Probably 5 to 7 the first week after surgery, and it's been steadily decreasing. 2 to 3.
Is it now?
Is what it is now, and I have a heavy job. I work 70 to 90 hours a week.
Wow.
Working on the large farm equipment.
Okay. Now you told me something that I think it's worth to mention. You told me about what you did and how long after the surgery you did that work.
After the surgery, I had a semi, and I needed to get to work with it, and I removed 8 tires from my semi, removed the rubber from the rims, and put the rims back on the truck by myself. 8 weeks after surgery.
Well, this is a demanding, obviously, very, very demanding job.
It took me all day. I had to be very careful with my body mechanics to do it, but I was still able to do it.
You still were able to do it, whereas, and that was 8 weeks after the surgery. So
exactly,
not only you were 8 weeks after the surgery to your work, but you were to that kind of work. Now, how long after surgery did you start working, go back to work again?
I had to take a job at this company at the 9-week point.
9-week point, okay. But obviously 2 months after the surgery, you were working.
Yes, the first week I did 70 hours.
Oh wow!
In the shop.
Wow. Now, how do you manage your day in your daily activity?
I work 70 to 90 hours a week, and sometimes I don't take a lunch.
Oh wow!
It gets to be a pretty hard slog when I spend 70 hours in the shop on a concrete floor, wrestling with tires taller than I am, getting into position to work on components that are buried deep within the machine. I have to be very careful with my body mechanics to make that, to be able to do that. But I'm able to do it.
So far, happy with the result of the back surgery?
Thrilled.
Oh,
this is so much better than the partial discectomies I've had in the past. The recovery time was better. The relief was much better.
Okay, well, thank you so much for the interview.